Uh, what I am going to tell you is gram staining. Prior to that, simple staining either with carbamazepine and methylene blue. When you suspect, for example, in gonococcal urethritis, if you suspect uh, infection with gonococci, you can do a simple staining using carbamazepine. It's a gram-negative diplococci, predominantly seen intracellularly. It causes gonococcal urethritis. Now, moving on to gram stain, it's one of the milestone in the history of microbiology. Hans Christian Joachim Gram discovered this, and it's one of the important staining techniques you should remember until you die. You practice medicine, and this is the basis for starting empirical antibiotics. What are beta-lactam antibiotics? What are the antibiotics which act on the protein synthesis, nucleic acid? And this is very important. Gram stain is one of the bedside investigation. This will, when you go to US, whether you go to Australia, New Zealand, Saudi Arabia, this is very important. Gram stain is one of the key staining basics of microbiology. What is gram stain? It's a four-step procedure. One is primary stain, second is Mordant, third is decolorizing agent, and fourth is counter stain. So prepare the smear. The smear should be thin enough. You can read the newspaper through it and fix it. Heat acts as a fixative, and cover the smear with any violet, methyl violet, crystal violet, gentian violet. Leave it for 1 minute and wash with water. Cover the smear with grams iodine for 45 seconds to 1 minute. Decolorize drop by drop with acetone or alcohol. Counter stain with safranin or dilute carbonation. Wash, blood dry, see under oil immersion microscope. Violet colored organisms are gram positive, and pink colored organisms are gram negative. So now ask what are the gram postulates, mechanism of gram reaction. Number one is mechanical theory, cell wall theory. The gram positive cell wall is thick, and it will not allow the iodine complex to go out. And gram negative cell wall is more complex, made up of lot of lipid. Alcohol being lipid solvent, it dissolves the lipid in the cell wall. The iodine complex goes out. Then cytoplasm of gram positive cytoplasm is more acidic, more affinity towards basic dye. And there are two chemicals which are present in the gram positive cell wall which are absent in the gram negative, are also responsible for retaining their primary state. What are those two chemicals? Magnesium ribonuclease and teichoic acid. So example of gram positive cocci are staphylococci, streptococci and pneumococci. Gram negative cocci are meningococci and gonococci. So gram positive bacilli, Corynebacterium, Erysipelathrix, Listeria, Lactobacilli, Anthrax, Clostridium, Actinomycetes. All these are, and even tuberculosis and lepra bacilli are fast, but they cannot be stained with gram stain because they have a thick mycolic acid in the cell wall. What is gram variation? If you do excessive decolorization, gram positive, gram negative, but gram negative never look gram positive. These are the various theories of gram. This is gram variation. So one of the important exercise you have to do it well and put a nice nice round and write whether it's given mixture, whether it's only cocci, whether it's bacilli, whether it's candida. Candida is gram positive budding yeast cell. So these are the various smears we give. You should stain and properly do it. Unless it carries almost 15 marks, 15 to 20 marks. And one of the important thing is you should practice. You should practice. Practice makes man perfect. So most of the time students fumble to do it, and they invariably ask the help of technicians, and examiner will be looking and here it's an awkward scene, and some people will break. People do not know how to focus the microscope. The adjustment of microscope under immersion is full light, diaphragm fully open, and 100x objective, put on oil, touch the objective, raise it up until you see something, and with finer adjustment adjust. So perfect this technique and do it well. It's one of the important exercises. Both if you ask in theory, practical it's one of the important exercises. Thank you.